Next, we will have Ashley Szofer. She is the Director of Alliance Development, Worldwide Government Affairs and Policy at Johnson & Johnson, where she is responsible for developing and engaging key advocacy partnerships on critical issues such as health equity, frontline health worker support, and access and affordability across the healthcare landscape. Ashley's passion for social impact and equity was also demonstrated in her leadership of Million Women Mentors, a movement to increase the confidence and interest of women and girls to pursue STEM careers and leadership opportunities through the power of mentoring. Ashley will discuss the mandate to support women in health professions and the community workforce through credentialing, workplace safety, mental health legislation, and other key areas. It's a prelude to our conversations that we will continue after lunch. Welcome, Ashley.
Thank you, everyone. So I want to start by just saying I was very excited to be able to do this anyway, but then Catherine was on the Hill with Mandy Moore last week, which is one of my icons, and now I'm 1 degree removed, and this is just exponentially exciting for me. But anyway, I'm here to talk about health workforce stuff. So I just want to start by thanking Society for Women's Health Research and Global Health Connector for continuing to create spaces to have these conversations. I think especially on the heels, of the UN General Assembly, when we have all these leaders in town for convening, it's a great opportunity to learn from each other, bring people together, and think about ways we can collaborate for further impact. And I think, the biggest thing here that I want to talk about is just how we're caring for those who care for us. So since our founding 140 years ago, Johnson & Johnson has had one main purpose, which is just to increase health access across the world. And we know that work really begins on the front lines. So how are we supporting nurses, community health workers, doctors, midwives across the globe to make sure that they are in the best position to be able to care for the world? So, and a lot of that comes down to our credo, which I should get brownie points. I've mentioned our credo, anyone who knows anything about Johnson & Johnson. But we are responsible to the communities in which we live and work. And that work really starts with how we are increasing healthcare through health workers. And today, patients around the world face poor outcomes in health due to a lack of access to quality care, as well as mounting strain on the health workforce. And with women as the vast majority of the global health workforce, the burden of that strain really falls on them, not only in their professional lives, but often also as heads of their household and families, and as leaders in their communities working on that care. So protecting their mental health and well-being, protecting their safety in the workplace, and creating opportunities for advancement and equity in their careers is really critical, not just for their own well-being, but for the entire world's access to care. So when we think about how we support mental health workforce, it's about how do we create leadership pipelines that allow them to pursue mental health treatment. At Johnson & Johnson, we have recently created Care Community, which is a global social impact platform that strives to champion nurses and community health workers to close those gaps between community and care. And we have reached 100,000 health workers so far this year and are on track to reach 1 million by the end of the year. And it's about creating resilience opportunities, mentorship, education, and support. And then even thinking about how we can support advocacy and policies that allow us to increase access to mental health treatment. So for example, here in the United States, Johnson & Johnson has been very supportive in advocating for the Dr. Lorna Breen Healthcare Provider Protection Act, which was signed into law in 2022 and is now up for reauthorization. And that legislation provides grant access for frontline health workers to pursue mental health treatment and also works to destigmatize seeking that care, because that has been a traditional issue as well, is that sometimes people are stigmatized or are not given opportunities because they have sought care for their own mental health, and we need to make sure that we're creating opportunities for that not to be the case. There's also the issue of workplace safety. Women being over 70% of the health workforce means that they are more likely to be harassed at work and see violence in their workplace. So we need leaders to come together to create zero tolerance policies, educate and train people to be able to handle these situations, and create work that actually protects the health workers while they are at work. And then finally, there are leadership advancement opportunities and gender equity that continue to be an issue despite women being 70% of the global health workforce. So how are we coming together to say, what are the leadership opportunities? We can do that through mentoring, through peer support, through additional resilience training, through scholarship opportunities to bring people into the health workforce. Because at the end of the day, if we don't have that thriving health workforce, we're not going to have the care we need. And we all know that there is a nursing shortage projected of 4.5 million nurses by 2030. So what can we be doing about that now is bringing all of these pieces together to come up with actual impact and results. So let's be clear, this isn't just a nice thing to do. It's not just because we want to help women, we do, of course, but this is not just an altruistic pursuit. It's really about how are we ensuring that we have a greater health workforce that allows people to be healthier across the world. Because we know if you're interested in education and business leadership, all of that comes down to health. If you're not healthy, you're not able to access any of those opportunities. So at Johnson & Johnson, we definitely believe that we cannot afford not to invest in this, and we want to make sure that the world is safer and healthier, and that really starts with protecting women in the workforce. So just thank you all once again for continuing to do this work on health research, on access to care, and of course on the health workforce as well. And I look forward to continuing these conversations and networking with all of you throughout the rest of the day.